Good morning. Dr. Bernard Kim here from Pondworks. Today I'm going to talk a little bit about the self-other dimension. That is something not out of Star Wars, but out of MBT, Mentalization, and it is one of four dimensions. The other dimensions are and I'll just name them off today. We won't talk about them in any detail. Save that for another day. But they are automatic versus controlled, self versus other, which is the one I'm going to talk about today. Then you have internal versus external. And then lastly, you have cognitive versus affective. I think, therefore I am, versus I feel, therefore I am, in a kind of shorthand language. But today, because I'm on the spot soon to learn more about this particular type of therapy, mentalization based therapy, to talk about self versus other, I thought, hey, let's talk a little bit here about that. And really, what we're talking about is how much one leans on the stability of the other versus leaning on the stability of the self. That's one way that you can describe it, meaning the more that I'm aware of what I'm experiencing, how some situation with a friend or coworker, how that experience is going and how I'm experiencing it, that is more the self end of the dimension. On the other, when we're thinking about ourselves and then the other, really the maybe central question to ask oneself is it a relatively simple, quick, based on maybe stereotype. In fact, stereotype would be an excellent example of really minimal thought and reflection about the other. It's relying automatically and quickly on some vision or some proscribed template of the other. So that's a stereotype. So how in depth are we looking at the other? And are we looking at them from a standpoint of our own stability, or are we looking at it more because we need that other person to be a certain way for us to feel stable? Okay. So this is a way for us to stay in touch with a particular type of reflecting. I think the important twist here that I'm certainly trying to learn within MBT therapy is that it's an empathy for what we're looking to gain in terms of understanding the other, and then also remembering to balance that against our own internal experience. If we don't think about how we're experiencing the situation, then we gauge it wholly and solely off of how the other is interacting with us in the situation, and we don't have any kind of internal compass. That is a recipe for losing resilience. Mentalization is not about some static, genetic, temperamental, unchanging resilience. It's really about this awesome, dynamic, fluid sense of resilience that, depending on how we engage with the situation, we'll have more of or we'll have less of. So that is the self-other dimension, one tiny snapshot. Many more can come from just talking about that one dimension, or maybe at some point in the future, we'll talk about the other three that I brought up at the beginning. Have a good day. Bye-bye.